welcome everybody to the inaugural Breast Cancer Summit. The summit program has been going for some time. Just in terms of background on the Victorian Tumour Summits, so this grew out of a need for having some kind of statewide meeting for the various clinicians involved in looking after a particular aspect of cancer, because by and large those didn't exist, and we tended to meet in our craft groups rather than as multidisciplinary teams. So the intent here is to facilitate a dialogue about the quality of clinical care, unwarranted variations in care, and potentially unwarranted variations in patient outcome, and use data as such as it's available. It's never perfect, but use the data available to inform the discussion. We also are very keen as part of this to encourage statewide tumour-based clinician engagement and leadership. All the members of the multidisciplinary team, and I'd use a broad definition of clinician, although we are pitching a lot to doctors here, and the reason for that is often the doctors are the gatekeepers to change and are in the best position to often facilitate change. But the breast care nurses, allied health, and also particularly the consumers have a very strong role to play. So in this as well, we do have the integrated cancer services in the metro and the regions, and the integrated cancer services are a structure which allow for taking what comes out of this meeting and assisting clinicians in putting that into practice. So in the lead up to the summits, we bring together a group of clinicians with consumers, and the intent is to use that group to look at the available data, try and sift through it, reanalyze what might be useful in terms of going down to some detail, and then in terms of trying to put that together in some kind of package that can inform us around what's happening in the state. So what we tend to learn from these summits is that the identification of unwanted variations is an iterative process, and for clinicians to do something about unwarranted variation, it's really quite difficult in a busy clinical practice to be able to do that. So there needs to be support for clinicians to make the changes that they want to change. We have to start with a big picture and drill down. The big picture may be very well known to breast cancer clinicians, but not necessarily to others. And what happens locally is really important also. Out of this, we want to see some priorities for action, particularly at the local level. That might be some particular piece of local work, but there may also be some overriding themes that come through as well that need to be addressed more at a statewide level. In previous summits, we've gathered together the clinicians involved in those areas. Usually we have around about 80 participants at each summit. Many more than that. Sometimes it can become a bit unwieldy. Generally, there has been a good rating in terms of the feedback as it being a useful exercise, and high rating of recommendation for colleagues to attend. So I hand things back to you.
Thank you. I'd like to join Paul in welcoming you to today's session. I'm here to introduce to you the policy context for the Victorian Tumour Summits. And the cancer plan is really the policy document that sets out government's policy and reform agenda. And it was released, the latest one was released last September. It is underpinned by 5 core principles, which I'd like to focus perhaps on 3 of those with you here today. And they include quality and safe care that is evidence-informed in terms of our practice, and that is person-centred care that takes account of the individual and has a focus on equity. So within the cancer plan, it actually goes across 5 core action areas for focus. Most of those sit within the remit of my program area, but some do sit with our public health colleagues in the primary prevention and screening area. It has a focus on improving cancer outcomes for all Victorians. So the statewide focus of this event is pretty critical. What is new in the cancer plan is that we've embedded the optimal care pathways, which you'll hear a lot about today, and I'm sure many of you are very familiar with them. And it's also introduced some new medium and short-term goals. So the optimal care pathways, these are documents that have been around for some time now, and I'm not sure whether this slide's been updated because in fact the second version or edition of the optimal care pathways were released earlier this month as a soft launch, but they are a pathway that tries to reflect and embed emerging areas of optimal practice. And many of you will have been involved in the development of the one for breast cancer, and it involves a range of experts to do that process, including those with lived experience. It then goes through a rigorous and extensive consultation and endorsement process. Now, this has actually changed a little bit subsequent to the first wave of these, with the putting into abeyance of the interjurisdictional RMAC processes. But before the National Cancer Expert Reference Group closed, it actually provided in principle endorsement for the updated optimal care pathways. So they are designed as a guide to optimal care for all of those involved in the system of care, delivery and receipt. I'd just like to digress slightly. This is a slide from Professor Robert Thomas, and it really is just to remind us that the optimal care pathways are not clinical practice guidelines. They're about the organisation, processes, policy development, and the creation of a framework or system of care that we can then operate within. And the purpose of that is to deliver the best experience of care and the best outcomes. So under the Victorian Cancer Plan, there is a reform program which is centred around the optimal care pathways. So it's centred around everybody who's involved in that pathway of care and the process and the systems of care. The reform starts with the measurement of the system against the optimal care pathways, and then goes through an implementation process to identify any gaps or any unwarranted variation that might be identified. And this is where the optimal care pathways provide us with a clear guide of what should be against which to compare what is. So there are, on this slide, a range of stakeholders and resources and initiatives that have been identified and called out. The Tumour Summits is one of the key initiatives that we feel fits into this reform agenda and supports the whole process. Paul touched on the process, and it is actually a mature program now, having started back in 2014. I'd just like to remind people that the whole process is having the summit. Then there is a period of time where improvement work is progressed at the local level and potentially at the statewide level. And it leads up then to a repeat summit at some future point where we can actually go back and measure and monitor the changes that we had perhaps hypothesised based on the work that we put in place. And this process itself is actually quite important to make sure that we are continuing to make improvement. Coming back to the cancer plan, as I said, it set out a whole range of short, medium and long-term goals. And the achievement of these goals will take coordinated and sustained effort across the sector. And these tumour summits contribute to that process. So as you deliberate today, please keep in mind when you're looking at the data, when you're considering your local practice, what would make a meaningful difference? What is the scale of change that is needed? Is it a local initiative or a statewide initiative? And then what do we need to be able to measure to monitor whether or not we are actually making a difference? And then finally, I'd like to acknowledge all of those who have been involved in pulling this event together, because it is a massive effort. And in particular, I'd like to thank the Clinical Working Party for their time and energy that's been put into getting us to this point, and also in advance for the efforts that they'll need to engage in as we go forward. And thanks to everybody else on this slide.